Most people experience dry mouth occasionally as a result of being nervous or upset, under stress, or dehydrated. But if you're experiencing dry mouth more regularly, it may be caused by something else. Now, joining us this morning to talk about dry mouth is Dr. Sean Moriarty with More Smiles. And let's get right to it as far as the definition. What exactly is dry mouth?
So dry mouth, which is also known as xerostomia in dental lingo, is basically a decrease in the production of saliva you have. So, saliva is important for a lot of different reasons, a lot of things we kind of take for granted, like eating, chewing, speaking, swallowing. It's also involved in the digestion of your food, and it helps to protect the teeth.
What do you think the #1 cause is for it?
Well, there's a lot of different reasons that can cause dry mouth, but the #1 thing is medication. We know that there's actually over 400 different medicines, which are over-the-counter as well as prescription medicines, which can cause dry mouth. So you definitely want to, be conscious of that type of thing. Other things like radiation treatment that's done to the head or neck can damage the salivary glands, as well as like autoimmune diseases like Sjogren's syndrome or lupus or rheumatoid arthritis.
You mentioned the medication. Is there anything specific that you should look for, maybe over the counter, that we might not realize that could be a factor or cause it?
A lot of anti-hypertensive medications and blood pressure medications, heart medications can cause it, but it's kind of across the board as like the #1 thing that side effect of medication.
Got it. And what would be a solution for it? How do you go about treating it?
Well, there's a lot of different solutions. You want to make sure you're well hydrated, so drinking water, and you can also chew like sugar-free gum or eat sugar-free candy, and sugar-free is the key word there. If you're eating candy and gum, you're going to be doing the opposite. But other things like there's things called salogens, which are medications that can be prescribed by your doctor or physician to kind of help you. You can also use things like mouth rinses. Biotine's a good one because it doesn't have alcohol, and any mouth rinse that doesn't have it, will help that condition for you.
And is there anything maybe you should change up in your diet or anything along those lines, things you might want to stay away from if you are experiencing it more than others?
Definitely, yeah. So if you know you have dry mouth and it's more of a chronic condition, you want to stay away from things that are kind of damage the teeth, because we know that, the saliva helps protect the teeth and remineralizing them, and it also helps to, basically protect them so they're not damaged and they're not getting decayed. So acidic foods you want to stay away from. Definitely things which are high in sugar and things that we know that are going to kind of cause damage to the teeth. So yeah.
Looks like I might have to switch up my diet here in between breaks. Doc, thanks so much for joining us here this morning. You can find all of this information on our website, fox43.com.
Angry family.